Good afternoon, everyone. It's April 3, 2023. This is Mia Schwartz. I am updating my rhinoplasty done in the Philippines way back 3 months ago. Now we have to look back what was being done during the surgery and times and what kind of procedures what they did. One is the teplasty. Two is the allarplasty and overall augmentations rhinoplasty. So what they did is the augmentations of rhinoplasty is that it is the nose job and increase the projections of our nose or whatever we desired. And the good thing I can say is let your doctors what you want to accomplish, and they can suggest to you what looks good in you and specific genes. Communicate to your doctors what you want to accomplish. So the allarplasty is called the small amount of skin that has to remove. So what they did is I have these wings around in here, and that's really not the bother, but maybe it can improve, and I just want to feel good about it. 100% I do this because I want to feel good about myself, not for others. And it's just I wake up in the morning, I want to feel good, and that's how it matter is. And then the tip plastic is that reshaping your nose. So for facial features, you want to look like your shape of your nose, how it looks like. So overall, the cartilage is forever, like it's permanent, that don't have to redo it again unless there's something wrong eventually happens. So because there's stitches inside still that they have to hold on to that. Or cartilage is an expensive term for rhinoplasties in our nose, and that therefore it's more expensive because it's consumed times harvesting your. There are kinds of cartilage rhinoplasties where they have harvest here on my 2 ears. Sometimes other people can do it in the ribs, and some others can your nose. So rib, ears, and that considered to harvest our cartilage. I went there at 10 o'clock, and then 11:30 I already get in to get my blood pressures and to see the conditions if I'm ready. So the thing is that I do not have my normal blood pressure is 100/80, and that's always taken that, and not in that a higher 110, that's the most highest. But during the time, I'm not afraid, I'm ready for it. However, in the back of our mind, we don't even realize. For me, it's a kind of a procedure. So I'm always kind of ready for it, and it's just slip and regarding my breast, regarding on my given birth for my child's, which is all normal. So I kind of used to it. So I was there. Long story short, I was there waiting for 2 hours to calm down because in the first place, I got 160 over somewhere we can think about is like a nervous breakdown. It's because a nervous is high blood pressure. I kind of 150 to 160, just like that. And then they have to wait a little 30 minutes. And then the second, it went down to 140. Oh, okay. Now I feel good about it. But it's just, hey, I'm not really a high blood, but what's happening in my body? So the response is you don't even know why you're nervous. Doctor says, let her sit down, calm her down, don't let her walk. Just sit down and relax, and then just lay your back. And after all of a sudden, it's went back to normal, which is 110. So that's perfect. I'm ready. So the total of that waiting is 12 o'clock, and then they gave me sedation to at least maybe block my mind to for ready for my procedures. I feel like my brain is knows something is going on. However, I'm not totally asleep, Oh no, I feel like the procedure step by step, I know everything exactly what happened, but my body is just don't feel that pain. So anyway, doctors got it done at 6 o'clock, so we more likely start at 12 to 6. So it's a long process procedure, because first harvesting in the first year, and then the second year, and then doing the stop in here. Of course, all of that process takes from 12 o'clock to 6 o'clock, and we're done finally. And I don't even feel pain after all, like after it's done. And then the first day, yes, at the first day, it's just total process. It's just a feeling of sensations, and I can say this is not like a breast augmentation, like you do not have to feel pain that much. But in rhinoplasty, it's takes so long for healing and process, and your nose, even your nose a little touch, the sensation is super hurtful. So anyway, now I choose to not to get any pain reliever in order for me to, I like normal process. Everywhere I go in surgery, I refuse to get pain reliever, just because it's up and at the other part of our brain. So in other words, if I can if I can control the pain, I will not for me, I will not going to take the pain reliever, and that's it. So in other words, 3 days I'm fine. And in here, so the cartilage rhinoplasty is done. After that is I have to take the medications, which I said again, I do not like to take any pain reliever. However, I wanted to finish my um, amoxicillin. The amoxicillin is amoxicillins that any infections that can prevent. And I took that for 7 days, and after that I'm done. And then the first week was a wound cleaning, because all of that blood was stuck in there, they have to clean. And then the second week, I needed to get the stitch removal, and then they have to get all of that. And then some other part, like in here, that close in here, they have also to remove of that. And then the third day, the final stitch removal is the third weeks, and that you're totally no more stitch in your face regarding the tips. And then most likely I have here, right here on the top only, because I have so much excess in here that they have to cut like the wings on my nose. And then the third is, yeah, you cannot eat. So the first week you cannot eat anything that can harms your incisions, together with eating some itchy like seafoods to make your skin itchy, so you don't want to scratch just like that. So avoiding that. And the second day, or any alcohols, avoid that for at least a month. It depends. For usually before and after week, that's the most important thing, that you do not put any alcohol on your body. So yes, I can tell you. So this is it. This is my doctor's. I have his names, and yeah, I'm so thankful, because you know what, I accomplished the thing I want. I want to be a natural look. I also wanted to make sure that I'm not gonna spend another 10 years to remove. So silicone sometimes can shape your nose in a better way, which is like, but the deformations is up to 10 years, where you have to repeat again and go back to the another surgeons to do some another step again, and you don't want to do that. So although pricing is a little bit a half thing what you compare to cartilage, which is like permanent. So what do you feel? Whatever you can afford, but I can suggest that if you have that little bit money and you spend it, maybe for me, I am 100% go for permanent, because you do not have to repeat yourself over and over for a long run, and that's what I say. So the cost is cost me 3,000 to 4,000 US dollars, or what we call it, for me it's like 200. More likely we spend $200. I think I spent 195,000
Pesos.
3 months. Is this is now the shape. There's like a scar a little bit and right here. And then what do I feel? I still have pain. The sensation is still here. More likely the smile is not like, it's not fully. I still have this softness in here, right here. And then the smile is not truly. But in compared to a month, you barely smile and it feels like so funny. And then the second month is a little bit stretch. The third month is you're fully stretched. However, this here, right here in the middle, it feels like, feel that sensations in there. I don't know how long, but I was still update that I smile in a normal way, because I know I know there's still like funny thing in here, still sensations in here. I touch in here, still I feel it. Yeah, I can say is I'm very happy I did it. And I am 37 years old now. And I think for us girls, it's not too late. Do what makes you happy. And if you can afford that, go for it. And go in a safe way. And that's what. First, look for a surgeon that have a license, and secondly experience, and for look for ratings, and that really can achieve what you want to accomplish, and let your doctor
Suggest?
your the projections and your genes, and that's it, and that's what I can say. And right now I feel normal in a way that I wake up in the morning, I do not have to think about my nose. But I will have to, yeah, I will have to put this prior, and then secondly, compare what really changed on my nose. So I know that the cartilage here are so thick now, and also the wings, which is amazing. It's done, and that's it for now. Thank you so much for listening to me. My name is Mia Schwartz. I am 37 years old, so that regards, you can pick up some. Okay, so you eventually you will go through this um, kind of surgery if you like to, so you know exactly what to prepare. And that's it for now. Bye.